During the past 2 decades, the image of multiple sclerosis has evolved from a mysterious malady to a controllable neurological disease with hope for the future. The estimated 400,000 Americans living with MS are not only managing the disease process with medications, but also learning how to manage the physical symptoms as well as the psychological, social, economic, lifestyle, and quality of life adjustments that come with this long-term illness. And as with many chronic and complex conditions, comprehensive care is emerging as a highly effective, sustainable model of care.
A comprehensive care model is a model which enables the individual to seek health care from all types of healthcare professionals to meet the challenges that they're facing living with MS. Not only their physical, medical symptoms, maybe some of the challenges with ADLs, activities of daily living, memory, cognition, and certainly some of the stress that they deal with in their life. Unfortunately, as the disease progresses, they'll be faced with many more challenges, not only physical and medical, but those that impact memory and cognition and impact the patient as well as the family. Comprehensive care provides a lifetime commitment to that patient to enable them to live as healthy and well as possible with MS.
Dr. Bennett, a physical therapist specializing in MS and neurologic rehabilitation, is the president of the Consortium of Multiple Sclerosis Centers. Originally founded in 1986 by forward-thinking neurologists, the consortium now represents thousands of multidisciplinary health professionals working to set a higher standard of care and clinical research in MS. By utilizing a specialized team of healthcare providers, this comprehensive care model is designed to address the complex and dynamic needs of all those affected by multiple sclerosis.
The Consortium of MS Centers is different from other MS associations in that our main focus is to educate healthcare professionals working in the field of MS to enable them to provide the best level of care to the patients and their families living with MS. We also work to stimulate and facilitate research that would enhance that care, and then we play a significant role in advocacy, working in governmental relations to ensure that the individuals again get the best access to care possible.
At different points along the disease continuum, care for a person with MS might include neurological, nursing, individual, and family education and support, psychological and psychosocial services, on-site physical therapy consults, occupational and speech therapies, and routine primary care and screening.
Multiple sclerosis can affect our patient in multiple domains. Therefore, a multidisciplinary approach to our patients is absolutely necessary. That includes medical services, cognitive assessment, physical therapy, social services, as well as assessment from a general physical standpoint, including evaluation for osteoporosis, hypercholesterolemia, and thyroid function. Cognitive status in our patient is often affected even early on. Therefore, assessment and coping strategies are very important to maintain their employment. Later on, our patients require continuous physical therapy, assessment, as well as program to maintain their independence and prevent their move to nursing homes.
This is the Jacobs Comprehensive MS Treatment and Research Center at Buffalo General Medical Center, one of the more than 200 MS specialty units throughout North America. This facility and its caring, talented staff embody the commitment and approach to comprehensive care the consortium thrives for, treating those with MS while developing a workforce for the future by training the next generation of healthcare providers.
The mission of our center is to lead medical and comprehensive care for our MS patient. We do see the importance of education of patients, families, as well as the new generation of healthcare provider. That include students, residents, physicians, as well as physical therapists, occupational therapists. The research going on at our center is primarily oriented to better understand multiple sclerosis, to identify the risk factors, and eventually to provide a personalized approach to each individual with multiple sclerosis. Multiple of our research is provided and funded by the National MS Society as well as along with the Consortium of MS Centers.
In 2010, we received accreditation for continuing medical education to provide CMEs for physicians that attend our annual conference as well as our regional programs. We've also received recognition through the Alliance of Continuing Professional Education, and most recently for the patient program we put together essential elements for the newly diagnosed individual with MS. I have to add as well, the feedback we receive from our patients who receive care from comprehensive care centers that are affiliated with the consortium is even more positive to us.
I would say the best part of the individualized comprehensive care is that all of the people that take care of you, everybody from the primary MS doctor to your therapist to the infusion nurses and other people, they're all on the same page. They understand your situation. You don't have to answer the same question over and over and over again because everybody knows what's going on. I feel well taken care of. I feel that all my questions get answered in a pretty good period of time, and I feel like I have a lot of different people understanding what I'm going through as a patient.
They treat you like an individual. They take care of every specific need you have. They make sure that everything they do is designed specifically for you and your needs and your specific problems, because MS is different for every single person. So they take their time to make sure that everything is designed and done specifically for you to help you do things you need in everyday life. Getting individual care from this center has been fantastic because it makes you feel like they care about as much about you as you do about, being able to survive and get over the disease and move on. And they care enough to make sure that everything is in order for you, drug-wise, therapy-wise, to be able to stay mobile and moving and go on with life.
We're continuing to explore new venues to provide educational programs for all of the healthcare providers that are part of the Consortium of MS Centers. Obviously, our focus is on providing the best care possible for those individuals living with MS. I think the take-home message for anyone that is interested in becoming involved in the consortium is that it is the vehicle by which you can really enhance the delivery of care that you provide. And I would add that a message to individuals with family members living with MS, you might want to make sure that you're accessing your health care through a Consortium of MS member.
MS is a complex chronic neurological disease, but research, symptomatic management, and comprehensive care has provided hope for the future. Learn more about the Consortium of Multiple Sclerosis Centers. Individualized and sensitive care does make a difference. For more information, visit mscare.org.